Good evening. I am Dr. Varghese Pallan, consultant neurologist at St. James Hospital, Chalapudi, Thrissur. My topic is benefit of triptans in quality of life in patients with migraine. So, as you all know, migraine is a chronic neurological disease with a incidence of 25% in females and 10% in males, and also 10% of patients with migraine have aura. So migraine is a chronic neurological disorder. It is one-sided throbbing or pulsatile in nature with a moderate to severe headache. The intensity increases with movement or physical activity, and also there is sensitivity to bright light and sound. So the triggers of migraine are the skipped meal and exertion, also bright light and noise, and also smell. Some patients they have definitely associated difficulties, that is provocation of migraine due to some perfumes, and also some patients when consuming chocolate or cheese they complain of migraine. Alcohol is also a common precipitant of migraine. The triggers, as I told earlier, was also lack of sleep, stress, in addition to skipped meals. Okay, so the goal of migraine is rapid pain relief, and also the prevention of recurrence, reduce the need of rescue medications, and also to restore functional ability. So the treatment is divided basically into two. That is abortive treatment. That is treatment to prevent the acute episode. That is abortive treatment. And second one is the preventive treatment. That is the long-term treatment. That is a safe and slow treatment. So for the acute treatment, to terminate the acute episode of migraine, you need NSAIDs, the painkillers, and also opioids, and a combination of these drugs, and ergotamine preparations. So now coming to the benefit of triptans in the quality of life. So for migraine, there is definitely a curve. It initially starts with a mild headache, then gradually progress to a severe headache. So the plan of treatment is to start a medication that will prevent the progression to the severe headache. So the Rizatriptan definitely has a role in abortive treatment. That is, as soon as symptoms start, it will terminate the progression of headache, and also it has to be useful. Like it can be carried with the patient in his pocket or purse or handbag. Then regarding the drug Rizatriptan, it reaches the plasma concentration quickly, and also there is a short t-half, and also a rapid onset of pain relief, and also it prevents the progression to the from mild to severe, and hence it is very useful in acute termination of the acute episodes of migraine. So there was a phase 3 study, meta-analysis of around 7 studies, of which 4,814 subjects were there. It was a randomized double-blind study. Rizatriptan 10 milligram was found to be superior to the placebo at 2 hours. And pain relief was found superior with Rizatriptan, that is 18 versus 37 for Rizatriptan, and pain-free intervals was also found to be superior with Rizatriptan, that is 7 versus 25 over 24 hours. So definitely Rizatriptan is having a definite role in termination of acute episodes of migraine. And the age group of the study was between 18 to 65. Then there were also other studies of Rizatriptan, that is the 24-hour migraine specific quality of life questionnaire, and that was done over a period of 1 month, attacks over 1 month, and a score was from 3 to 21. And next one was the short form health survey, that is the generalized health related quality of life aspects. That was 8 domain scores, and mental and physical competence scales were also taken into consideration at 2 6 and 12 months, and the score was between 0 to 100. And Rizatriptan definitely had a higher score in both these studies, that is 50.3 in the short form health survey, where Rizatriptan group had 50.3 and the usual group was only having 48. So there was increased improvement in work functioning, social functioning, and a reduction of migraine symptoms and feel good situation in patients with who are consuming Rizatriptan. Rizatriptan, when compared with other drugs, were also found to be far superior. That is, pain-free interval at 2 hours, that was 40% for 10 milligram Rizatriptan group, was found to be superior to 100 milligram sumatriptan group, which was only 33%, and also 40% for Rizatriptan group against 50 milligram of sumatriptan, which was only 35%, which was also shown that Rizatriptan was superior, and also 38% for Rizatriptan 10 milligram group against sumatriptan 25 milligram, which was only found to have 37. Then next, against the naratriptan group also, Rizatriptan was found to be superior with 48% pain-free interval at 2 hours, and also the naratriptan group only showed 21%